3 in 4 women experience premenstrual physical or mood changes. For women suffering from premenstrual dysphoric disorder or PMDD, the monthly symptoms are more than just annoying or uncomfortable. They affect the ability to work, impact on relationships, and increase their risk of suicide. Now, while premenstrual syndrome is well known, affecting at least 75% of women, PMDD is a more severe form, recognized as a clinical mental health condition and affecting approximately 5% of women. Some describe feeling as if a switch has been flicked to turn them into a different person in the week before their menstrual period. Dr. Bavi Vythilingum is a member of the South African Society of Psychiatrists. She says PMDD impacts severely on a woman's quality of life and ability to function. It can also cause major mental health disorders such as depression, to the extent that more than a third of women with PMDD have attempted suicide. All right, so let's speak to Dr. Bavi Vythilingum to talk about this matter as we reflect on Women's Month of August here in South Africa. Very good evening to you, and thank you so much for speaking to us. So I want to firstly understand what is the difference between PMDD and when we talk about particularly PMS, the symptoms thereof. What is the difference?
So PMS, as you mentioned, affects many women, 75 to 80% of women. And PMS is physical symptoms like breast tenderness, bloating, and mental symptoms like mild mood changes, irritability, and things like carbohydrate craving. But it doesn't really impact on your functioning or impact on your relationships. PMS symptoms, women can still function, they can still cope, it goes away very quickly. PMDD, on the other hand, is really severe changes in mood. The key symptom of PMDD is, in fact, mood changes. For that period of the month, women experience clearly diagnosable changes that equate to a major depressive disorder or severe problems with anxiety. Often women can become suicidal during these times. And that's really the key difference between them. There's this real impact in functioning and really significant distress with PMDD.
I want to just go back again to the issue of PMS. We know that women also experience menstrual pain in varying degrees. Women with endometriosis, for instance, are prone to very severe period pain, severe bleeding, etc. So is this sort of like a middle ground? I just want to understand who's vulnerable to PMDD, and is there a particular stage when it presents itself? Because women who then also become premenopausal will experience bodily changes as well, which also have a mental, chemical defect.
So PMDD is really linked more to mood disorders than it is to physical conditions.
Okay.
And PMDD can really present at any time during the course of a woman's life. Women with PMDD typically start presenting with their symptoms during their late teens, early 20s, but you can really get it at any time. Some women do present for the first time later in life after they've had their kids or during the perimenopausal time. The major risk factors are women who've got other mental health problems. So women who've experienced depression or anxiety at other times of their lives, particularly in later life, women who've experienced depression or anxiety with childbirth. And PMDD is in itself a risk factor for postnatal depression, and it's a risk factor for women who have worse mood and anxiety problems during menopause.
Are you saying these women are predisposed to getting PMDD, and how is it diagnosed, particularly a correct diagnosis?
So what we need to look at is we need to track mood during the menstrual cycle. And ideally, we want to look at 3 menstrual cycles going forward. So To make a diagnosis of PMDD, we need to look at marked changes in mood that happen in the second half of the menstrual cycle, that's after ovulation. And these changes in mood must resolve within a week of the onset of getting your period. Some women have mood changes throughout their menstrual cycle, but they get worse during menstruation or worse just before their period. That wouldn't be PMDD. It's still something we address, but we wouldn't be PMDD. For PMDD, women would be essentially normal during the first half of their menstrual cycle, and then in the second half of their menstrual cycle, they'd have these really, really severe mood changes that pretty much with the onset of their period would go away within a couple of days.
I see that ovarian cysts play a role in terms of healing options. What is the relationships?
Sorry, just say that again for me.
Ovarian cysts.
So there is a relationship between polycystic ovarian syndrome and PMDD, in that some women who have polycystic ovarian syndrome get worse PMDD symptoms. And we think that's related to the general hormonal dysregulation in both of these conditions. And we think that it might be related to a hormone called progestogen, which is raised, and particularly raised in the second half of the cycle. And through the hormonal treatment of both these conditions, we can get resolution of both these symptoms. So in women with ovarian cysts, we would work closely together with the gynecologist to treat both these conditions and hopefully get resolution of both these conditions.
I see there's mention of antidepressants and birth control pills, the role that they can play, particularly in controlling hormone levels and relieving physical aches. But I want to understand, when we talk about overall menstrual health, including lifestyle changes, what are we talking about here? And also we talk about period poverty. If you can just juxtapose that for me.
So PMDD is a mental health condition. It's a disease in the same way that depression and anxiety are diseases. And we need to see that, and we need to treat it as such. So that the two major forms of treatment are to use antidepressant medication, but we use them only in the second half of the cycle. That's when you get symptoms. So you would use them intermittently. Some women respond very well to taking an oral contraceptive pill, and we can use that either alone or together with the antidepressants. So those are the treatments for PMDD. PMDD is not going to go away just with general good menstrual health. General good menstrual health is really, really important, but it's not a treatment on its own for PMDD. It is an important adjunct. So things like good menstrual hygiene, exercise, good sleep habits, supplementing with omega-3 fatty acids, iron supplementation, these are all very important things, and they're very good adjuncts to treatment, but they won't actually treat PMDD. Period poverty is a huge problem in this country. But again, I think it's a slightly separate issue from PMDD. It certainly worsens PMDD in those people who suffer from it. You've mentioned that figure of 5% of PMDD. That's a global figure. We don't actually really know what the figure of PMDD in South Africa is, because we haven't really had studies to look at it. Our gut feeling is it might well be higher, given that our general rates of depression in this country are higher, and that we know that poverty is a significant risk factor for mental health problems. And it's reasonable to
We're going to have to leave it there. We're going to have to leave it there, but thank you very much for your time, and hopefully at some time during this month we will talk about period poverty, because unfortunately when we talk about how to help the girl child, we often just reduce it to giving the girl child menstrual pads, but we need to go a little bit deeper into it, what is involved in their menstrual health and well-being. Dr Bavi Vythilingum is with the South African Society of Psychiatrists. We're going to leave it there for now.